On April 25th, I embarked on an adventure to Zambia, Africa. On this trip, we were fortunate enough to have been able to meet up with a multitude of Zambian experts from diverse stakeholder groups. Some of these groups included NGOs, researchers, community members, and volunteers that took the time out of their schedule to sit down with us, as well as many, many more individuals full of knowledge to share. My goal on this trip was to enhance on major health issues in Zambia and the determinants of health behind them, as well as to consider any key factors to help promote positive change. I focused on the major health issue of HIV/AIDS within Zambia, and throughout this video I will explain who we met and how they are contributing to the success of the decline in HIV/AIDS within Zambia. Many individuals globally are still facing the effects of HIV/AIDS. Zambia is among multiple countries in the African region with a high prevalence of HIV/AIDS. However, over many years, the burden of this disease has been slowly declining. In Zambia, although significant progress has been made considering political, economic, and social development, malaria, HIV/AIDS remain a major health issue within Zambia. In 2016 alone, Zambia had 59,000 new HIV infections and 21,000 AIDS-related deaths. The government of Zambia has recognized the severity of the situation, and there has been a renewed political and financial commitment to improve the health of the population of Zambia. Zambia has recognized the need to take action against HIV/AIDS by providing and ensuring appropriate services and resources are available to their citizens. In Zambia, the HIV prevalence has declined significantly among adult population, but women and adolescents continue to be vulnerable to this infection. This is where the NGOs, researchers, partners, and community members, and all the volunteers that have stepped up to help the decline in HIV/AIDS has become a huge positive research within Zambia. UNICEF, for example, which is the United Nations Children Emergency Fund, is an organization that is dedicated to be a committed partner to Zambia and to help advocate for women and children that are affected by HIV/AIDS. UNICEF works alongside the government of Zambia to further increase access and resources for HIV services for infants, adolescents, and mothers to prevent the transmission of HIV. Between 2007 and 2014, UNICEF was able to establish HIV testing among adolescents aged 15 to 19, which has increased by 150%. They continue to support and promote adolescents' HIV testing through a multitude of media that can reach out to individuals, such as through short messages services, radio, and peer-to-peer methods. The World Health Organization, also known as WHO, is another organization that has been providing support to the government of Zambia and has developed a partnership since 1965. During our trip to Zambia, we got the chance to visit the Bafano Community School, which was established in 1996 in response to the increased numbers of individuals living with HIV/AIDS, TB, and orphaned or vulnerable children within the Lusaka district of the Lusaka province of Zambia. Botswana has been a massive advocate for developing a comprehensive, multi-sectoral service organization, providing quality care and an abundance of services support to the community. The number of orphans is increasing in the community due to high death rates caused by HIV/AIDS. A consequence, many poor families must take in their relatives' kids when a mother, father, or both parents die, whereas they are not able to face their own basic needs in food. The government statistics show that on average, 700 people die daily and 2 million are affected by HIV/AIDS. They are focusing on HIV/AIDS. As they focus on HIV/AIDS, they become to learn that the increase of infected people is due to negligence, insecurity, poverty, and cultural practice. Certain practices like polygamy, traditional circumcision, or wife inheritance are affecting and increasing the spread of HIV/AIDS within the community. However, they do not try to fight culture, but they do try to make people aware of the risks of getting AIDS by practicing certain community traditions. Social and economic consequences of HIV pandemic research in Africa has documented that the severe economic consequence of HIV/AIDS pandemic is at a household level, showing that adults with HIV/AIDS severely compromise household family resources, as their functional capacity to work and earn a living for their families is reduced, and their illness generates new financial demands to cover medical treatment and funeral expenses, threatening food supplies, health care, and education for surviving members of the family. Isaac went into explaining that in the beginning of the HIV pandemic, people did not understand what was happening. People would seek out health care services, but then get sent home and end up dying in their homes. The family members did not understand what was happening and would be scared to be around that family member, for they were not told or educated on what it was, for they themselves did not know. Having the ability to educate the community and healthcare services on what HIV/AIDS is and how it affects a person and how it transmits from person to person has been a positive change for the community. Our journey then brought us to Western Province in a little place called Mongu. Throughout our trip, everybody who we had spoken to was very realistic about the situations that are present in Africa. They were very honest about speaking on why these are still present and what they want to do in the future to help decline HIV/AIDS once more. In Western Province, we got the opportunity to sit down with Johannes. Johannes was able to talk to us about HIV/AIDS and how it affects women and children. Johannes' company is stepping up and helping advocate for women and children and being able to talk to chiefs in creating bylaws on teenage marriages. Having Johan as a partner in this study was absolutely incredible. For Johannes and his company, Kawatsu, are able to talk to the chiefs, One of Johan's great accomplishments is being able to reach out and speak to chiefs around women-based violence and teenage pregnancies. This has not happened just over the last few days, but has taken the past few years to be able to get to this point. Johan's enhanced on the importance of being able to have the chief involved with changing policies and bylaws, and the skills involved with speaking to a chief about their practice in a way that does not challenge them or make them feel as if their own practice or culture is wrong, but being able to educate them on the changes that have to be made to be able to promote a healthier and safer future for women and children. He also shared that once a chief accepts to help change policy and bylaws, that they are then able to reach more chiefs. This progress alone is exciting to see, and knowing that people are able to step up and make the change that is needed is what is leading us to a positive future. Lastly, we got the great opportunity to talk to Jackie Campbell. Jackie Campbell was able to talk to us more about the determinants of health that affect HIV/AIDS, also women-based violence. When looking at HIV/AIDS, it is important to have an understanding of what social determinants of health can affect it. Some social determinants of health, such as poverty, education, roles in family, and culture, play a large role in HIV/AIDS. Our understanding of the connections between these determinants and their relative importance to each other has evolved over time. HIV prevention has been dominated by individual-level behavioral interventions that seek to influence knowledge, attitudes, and behavior, such as promotion of condom use, education about sexual health, and education on injection use and about the dangers of sharing equipment. The amounts of education and knowledge that I have gained over the past few weeks has been so inspirational, and the gratitude I have for the individuals willing to take time out of their day to speak to us about women-based violence, teenage pregnancy, HIV/AIDS, and any other interests that we had. I would like to take time to thank them for taking their time on helping educate us of health promotion and health issues that are in Zambia.